This was the largest disaster response that I had ever been involved in, and as it's turning out, probably the largest that the United States has ever experienced. I had an opportunity prior to this, a few years back, to work with Dr. Spires with a few other hurricane programs, but they were much smaller. And so we were able to kind of reconnect them with resources because the basis resources themselves had not been affected. This was much different. We did not have our own resources to be able to provide to folks and had to rely on outside resources for a long period of time, which was a help but also complicated things because each particular state, Philadelphia is different from Louisiana, which is different from DC, has a culture of its own. And so having folks come in, we wanted to help them understand how to assist the survivors, what would be unique about working with folks from a particular area. And again, it was different because we had people from one area who had been displaced to another, who felt very unwelcomed at one point, misunderstood, just isolated. And so it was very complex and very different for the magnitude of people that were displaced, the amount of damage that happened, both to homes and to our own public infrastructure, not having our own staff available because they, like myself, had been displaced, many as far away as Georgia and Oklahoma, California. And so someone who could have been a support to a survivor who, take an example, was living with a mental illness was not available to them. And so we had to be skillful in matching folks who would go out and then re-engage those folks so that they would not regress or have difficulties accepting the services that were available.